call the Health Committee meeting to order October 6th, 2015 at 10:17 a.m. All members are present, unless Jed.
Jed's called me last night, asked me to pass along to you that he's not able to be here yet for the Chicago.
First item on the agenda, public comments. Are there any public comments? Seeing none, we'll move to agency reports. Are there any agencies other than health? Seeing none, Iroquois County Public Health Department reports.
Good morning.
Good morning.
I've got you a list of the services that the health department provided during the month of September. Actually, the list is cumulative year to date. So it starts September 1st and runs through and tells you This summary report goes through our environmental health program. You can see that inspections were up during the month of September quite a bit. From August. We will notice on the claims that mileage went up in September. We had a lot of restaurants that needed to be inspected. We had quite a few re-inspections, as you'll see. There were several complaints that had to be investigated, issues that needed to be addressed. Environmental staff did a great job in taking care of those things. We did 37 water samples, 5 well inspections, 5 new well inspections. And then you can see the other permits and ceilings that were done. We had 8 private sewage disposal inspections this month. That's probably been our biggest month since we've been here. And then it follows down. West Nile surveillance has stopped, but Iroquois County did have a human case of West Nile virus that was investigated, and with laboratory confirmed that a positive case. So that's been addressed well. If you skip over to the community health summary report, you can see that childhood and adult immunizations during the months of August and September were up. Typically when kids get their shots when there's no flu infection. You can see that we did 56 flu shots during that last week in September. We started our flu clinics, and those are underway and going strong. If you look down under the reportable communicable disease investigations, most of our investigations were, average numbers, what we've been running to date. You'll see that we had 10 different rabies investigations. 2 of those people out of the 10, those are 10 separate incidents. Two of the incidents involved people having to take prophylaxis. One because one person won, and one was looking with that was found. And then the other one was because the bad bite occurred on a weekend, and the emergency physician had started prophylaxis and still repeatedly was back to them. So 2 of those received prophylaxis. We did 11 one step EDC tests out of 2 a month. So that gives us a year-to-date total of 104. In other words, the numbers are pretty stable. Our community outreach events, educational presentations, we did 13 of those during the month of December. Many of those were at 911 in coordination with 911, and we went to schools and specifically did a lot of education on like drugs and things that come by the house that children can often take for something that is edible. And then obviously we have food clinics starting again, so you'll see numbers there. Under the dental program, where it says to be determined, I just want to make you aware that the reason that we have a zero for that and to be determined is because the dental sealant program typically start in the spring. We do those February, March, April, and May in school. Everything else, I think, on the list is pretty self-explanatory. Does anyone have any questions about our summary report? Okay, the other thing that I gave you was our grants and contracts, and I have updated that. So you can see what our grants and contracts specifically are, what those dollar amounts are. You can compare them to the FY15 amount, and see where we're at on those. We still have Safe Drinking Water, where we have submitted that grant, but have not gotten a contract back from them yet. We have been told that that grant, and as well as the lead grant, probably will not be signed until there's a governor's budget in place. But they fully expect to be executed. So I'll give you a second to look over the grants on contract and see if there's any questions that you might have regarding any of those. Just to give you an idea what we're looking at that, of what kind of payments that are coming in, even without a baseline budget. Most of our grant money that are state grant, those grant money are obviously not going to be paid out. The grant entities have given us very specific instructions about sending in the EDM, the expenditure documentation form. We send those in the 10th to 15th of every month for services provided in the previous month. Those are all being submitted, they're being queued, but they're not being paid out by the state control office at this time, it's the state money. Those grants that involve federal dollars, for example, those are being paid out. It's just, it has been mandated and the federal money that comes to take paid out in the local health department. So we're receiving our WIC payments. We are also receiving our MEDI vouchers, but we have not received any MEDI payments. If you were to tell whether or not that is because we've been told that MEDI will be paying, but specifically for the service that we've provided at the beginning of a grant year, which is July 1st, we bill for those in August. We usually don't see payments until September or late September or October anyway. But we have been told that it affects those many payments, and like I said, we have received vouchers for the claims that we have submitted. We are receiving Adult Protective Service Fund and CCU Fund. Department of Aging, they're paying. We're also receiving all of our contracting payments for example, our school contract. We're still receiving fee for service money, so our environmental inspection and fee for service money that was on a retained basis. And then we have also July 1st received two tax disbursements on July and September 25th. So, even without state payments coming in, the health department is at this time not forced to lay off any staff or furlough days or any of those types of things. So we're in much better shape than many of the health departments. I met with the regional Illinois public health administrators, so all the public health administrators from 13 different counties in our region met on September 20th, Friday, September 25th, and we discussed our financial situation, what was going on in each county. And the important thing about being included in that kind of discussion is that we all know that if a communicable disease outbreak happens in another county, eventually, if they're not able to, they don't have the staff to control it, eventually it will certainly cross the county line. So, the Illinois Public Health Association is hoping that Senate Bill 2178 will pass. That is a standalone bill asking legislature to pass legislation that requires the payment to the local health department for the local health protection grant funding. Local health protection grant funding includes potable water, sewers, food protection, immunization, and communicable disease. Those 5 things. Many local health departments are in need of that payment right away in order to not continue that way up. Yesterday, I went to a meeting at the Macon County Health Department with the regional administrators, legislators were invited to attend. Tom Bennett, our state representative, did attend that meeting. He drove to Macon County Health Department investigators to represent Iroquois County and Fort County and Livingston. And he was very receptive to the information that we provided. I'm not that way because they're going to a list of what's going on with surrounding county health departments. Actually, health departments throughout the state were provided. It's 2 pages long. And it has the mechanisms of action that are being taken by public health officials to reduce costs within the public health department. And that is laying off staff, restricting travel, restricting training, furloughing, that type of thing. I'm very cognizant of the need to be very fiscally responsible during a time when we don't know when the state budget will come about. Your guess is as good as mine, and different legislators give their opinions about when the state budget would come about, but sometime between now and March.
A question in regards to that, as it relates to the financial climate, based on where we started, where we're at today in terms of head count, full-time, part-time, can you kind of expand on that a little bit?
Yes. We started out July 1st of 2014 with 17 employees. We now have 16 employees.
Of which full-time and part-time?
Right now we have 11 full-time and 5 part-time.
Did you know how the 17 broke down before?
Yes. I think it was 10. So it would have been 11 to 6. Is that correct?
And is that on track with budget?
Yes. Our cash balance as of September 25th was $597,000. Our operating expenses are approximately, at most, $119,000 a month. So right, that would give us close to 5 months reserve. But we also have those fees that I just discussed will also bring in. So it's not like we don't have money coming in to help us with that. So I don't anticipate the need to decrease service hours. A lot of the health departments are all going 4-day work week. I don't anticipate the need for that, not at this time. And most of the grants that are being discussed at the state level that are questionable for funding are grants that you don't have your friends in the public health department. The grants that meet the state priority list for funding are the grants that we have. So we have a lot of grants that are above and beyond, and year to year we're hiring someone and then they're evaluated on need and they're yearly basis. That kind of money goes over there. Not in that situation. Any questions regarding the contract? Thank you.
Thank you, Dee. The next item of business, the claims. Please take a few moments to go through those, and if there's any questions, please bring them up.
Dee, what's FERCOG's for meetings?
The Adult Protective Service grant encourages, that's our only grant that the health department has, that encourages that we see people that come to that management meeting, because those are police officers on duty. They are, the state legal services, It's a group of professionals that meet to give advice on the adult protective services that are going on. And they encourage that we meet during lunchtime, so that we can get those people to attend those meetings and we see them. And they reimburse us at 100% for being in. That is the only, and then that is paid through the Department of Aging, that is the only grant that allows us to feed people for a meeting.
Who are you feeding during that time?
It's a lot of it's bakers. The women think who's on that committee. From First Trust, it is Mr. Rhodes, D. Rhodes. From the County Sheriff's Office, it is Mr. Officer, W.D. I don't know what the title is. W.D. Officer Shane Edie.
Well, I was more interested in where they work, because if you were feeding people that are already being paid under tax dollars, it might, not saying it's not correct, but to the taxpayer, it might appear, you know,
Well,
if that's a bill.
I'm going to say it's very specific on who people are on the committee. You have to have legal representation, you have to have law enforcement representation, you have to have banking representation. I think OLN runs those meetings and takes care of those. But that is around the grant that they want you to be in them during a meeting, to get them to come. So that, case questions, can be addressed in the instances that we work with.
It looks like it's split in half between elder abuse grant and APS capacity building activities.
Yes, because the elder abuse grant really are what our typical APS grant, and then the APS capacity building grant is a new grant that we got this year, that is specifically for those who are self-neglect. Who participate in self-neglect behaviors.
Move to approve.
Any other comments on the claims? Before accept Bill's motion, I did have one. The other, did you say you were on travel restrictions now?
No.
Now, okay,
No,
because your
no.
mileage is up around 4,000, so.
Yeah, actually, I told, this was by far the highest mileage we had for, especially for environmental health, that you can say that we went from averaging like, in August, 30 inspections to 50 inspections, we had 14 re-inspections, the sewers were up, a lot of complaints this month. It was a huge month for travel. Let me assure you that the environmental staff worked their tail off. A lot of work went into that. Very, as an administrator, very, very proud of the amount of work and the accomplishments that they did in September. They worked very hard.
There's a motion on the floor to approve the claims. Is there a second? Brett, second. Any further discussion on the claims? Seeing none, please call the roll.
Schultz,
Yeah.
Schmidt,
Yeah.
Kersley,
Yeah.
Crumbity.
Yes. Next item on the agenda, old business. Seeing none, next item, new business. John?
There's a matter that I wanted to bring before the committee regarding the approval of claims. Dee is passing out a copy of the state statute and also an Attorney General's opinion.
Nope.
The state statute that she's passing out covers the duties and responsibilities of the Board of Health. If you look at item number 12 on the second page, you see that the power of the Board of Health, the authority of the Board of Health is to prescribe the powers and duties of all officers and employees, to fix their compensation and authorize payment of the same, and all other department expenses from the county health fund of the county or counties concerned. So this It appears to me to be an indication that it's the Board of Health that should be approving the claims rather than the Health Committee. It's further amplified by the opinion from the Attorney General that actually goes back to 1979, but if you were to read through that, you'll see numerous statements in there indicating that the county board appoints the public health department and the Board of Health appoints the public health administrator and therefore has control over the actions of such administrator. It goes on to say that the county board is not under the existing statutory scheme authorized or empowered to take any actions regarding that. In other words, the Board of Health is the one that is supposed to have that responsibility. I've discussed this matter with Mr. Devine. I've discussed it with Kyle Anderson also. They agree that we probably should be considering very seriously making a change in order to follow what the law prescribes. I guess the plan would be to, as I said, to bring it to your attention and to determine what the course of action should be, which personally I would hope would be that we would decide to follow what the statutes require. To me, it's an example of something that actually came about at the PNP meeting last week where Anita brought up a couple of matters that she had researched and found out we were not following statutes and she had made changes. And I think this is something that follows in that same line. Do you have any questions about this or comments?
No, this is the first I've seen this, of course, today. And I think we should definitely consider that if we need to follow a different protocol. I think we're in a little, in my opinion only, I think we're in a little bit different situation because we restructured everything and we took something that was not following protocol and then got it on the right track. And I just think we need to be a little careful because, yes, those things you said are true, but if you read into the statute, it says the county board, of course, exercises the authority over the county health department through its powers to appoint and remove for cause members of the Board of Health and to control through budget and the power to levy the fiscal affairs of the department. And, of course, empowered to discontinue the county health department it created. So, you know, we don't want to get into a big power struggle either.
Right, and that's not what this is.
Right.
I mean, personally, it would mean a lot more work for me, but my interest, as I mentioned to you earlier today, is that we will follow what the law says.
And we also go back to having a health committee at one time. I probably have to ask Dale here because he's prior to me, but we discontinued that because of the recycle center, the funds ended, correct, the tipping.
Yeah.
So then it rolled into tax, and then through the course of events, we enabled it again. But even with the original health committee, we did approve claims for the health department.
No, it was for their claim. At that point.
And I think if I may say that even though there is some duplication, having the presentation that Dean makes every month is a very valuable thing, particularly to help the taxpayers in the county be aware of what's going on and for the activities of the health department to be kept accountable. And as far as the claims are concerned, there would be a sheet that you would receive every month that would indicate what claims were approved and so forth. So it's not necessarily taking, trying to diminish the power or authority or activity of the health committee at all.
Well,
in fact, I think personally that, and I've mentioned this a couple of times, that I think there are a number of other county agencies that should be more active in reporting to this committee, and giving the committee more oversight into what they're doing.
And I want to make it perfectly clear that I'm not speaking of this committee, it's the county board. So if this committee didn't even exist, this is my opinion again, yes, this is the law or what's perceived to be the opinion of the law, but it is hard for me to believe that monies could be approved that are collected from the taxpayer by someone other than an elected body. Now, I know there's cases where it's not, but maybe it's not correct, but, you know, as things progress forward, you know, the laws do change again, but that's from an ethical standpoint, I'm just looking at it that way. Whether this committee exists or not, I just think the county board would have the say on this, the tax dollars collected.
Well, but here again, you know, when you went through the levies this morning in the tax committee, several other bodies that you're levying for, and there's no approval by the county board at all, and how those monies are spent. Mental health, right on down the line.
Right. Doesn't make it right.
And I'm not sure I think that's right.
Dale, you want to comment on that?
Yeah, I'm not comfortable doing anything about this today. I think it's something we need to discuss, and we can continue the discussion. But I would make a motion to table this issue until next month to give us an opportunity to study the statute and make sure that we're comfortable with any changes that might be advisable.
Is that considered the motion? Right.
But we can, I mean, obviously,
The discussion, it would be to also, it's on the agenda, correct? Added to the agenda.
And in the meantime, if there's anyone that would have any questions about exactly what the mechanics of this might be and how we might make it to work to everyone's satisfaction, please get a hold of me. We can talk about it.
And as usual, maybe we'll poll some other counties and see what's happening there as well.
Okay.
Oh, we got a vote? No further discussion? All in favor? Aye.
Aye.
Opposed, same sign. Motion carries. Any other new business to come before this committee? Seeing none, I would entertain a motion to adjourn.
I make the motion.
Second. The motion, please.
second.
Dale? All in favor to adjourn? Aye.
Aye.
Same sign. Opposed, same sign.